Good afternoon to my fellow Augustans. I'm Mayor Hardie Davis, and I'm extremely excited on this afternoon to welcome to our city virtually to my fellow Augustans. I'm Mayor Hardie Davis, and I'm extremely the pleasure of sitting down with our U.S. Surgeon General, Dr. Jerome M. Adams, to talk about the global pandemic COVID-19, vaccines, what we need to do in order to instill trust among our citizens, to overcome fears associated with the vaccines, and more importantly, the rollout of the vaccines and how each of you can take the necessary steps to be vaccinated. I want to thank you, Dr. Adams, for joining me today for this most important conversation. Before we dive into the conversation, I'd like to give you an opportunity to introduce yourself to our viewing audience. For those of you who are joining us by live stream, Dr. Adams is no stranger to the community, having been here most recently at Augusta University with Dr. Kathleen Toomey, our Director of Public Health for the state of Georgia, and our governor, and the wonderful team that we have at Augusta University, Dr. Brooks Keel and Dr. Kathleen Kiefer. Dr. Adams?
Wonderful. Well, thank you so much, Mayor Davis, for making the time out of your busy schedule to allow me to talk to the people of Augusta. Incredibly important that we have these types of conversations. One of the things I want to start off by saying to everyone is that it is absolutely okay to have questions. And one of the things I encourage people to do is to ask more questions when you are visiting your healthcare provider, when you're talking to people about your health and the things that can either improve or harm your health, because we want you to be informed. So don't let anyone shame you for having a question. And we'll dig a little bit deeper, I'm sure, later into the mistrust that comes from a historical place, and many people carry that legacy around with them. But what I do want to say is that we can't afford to let misinformation or mistrust cause us to make decisions which are bad for our health. And so the most important thing I want people to take out of this conversation is that we need to get used to asking questions of trusted resources so that we can make better informed decisions, whether it's about smoking or whether it's about the foods we eat or physical activity, or whether or not we decide to get a COVID-19 or a flu vaccine. But I want people to know this is incredibly important to me too, because I grew up in a rural Southern Maryland, ironically enough, on an old tobacco farm. And I was poor, obviously Black, in a rural community. I have asthma still, and I know the challenges that many people from communities like this face when it comes to being healthy. I know that vaccines are one of the greatest public health advancements of the last 50 years in this country, but I know the benefits haven't been shared equally or equitably among individuals. And I know that people who come from communities like mine, we can't afford to give up any chance that we have to gain ground and to get back to that same starting line that everyone else is beginning from. I also would just quickly mention, I'm a father. I have a 16, a 15, and an 11-year-old. So I'm struggling just like everyone else in the midst of this pandemic to figure out how to get my kids through virtual learning, dealing with the mental health impacts, the lack of sports to keep them busy. They're at each other's throats at home because they'd usually be out getting their energy out on the court or on the field. And I also have a wife who's dealing with a cancer diagnosis at this time. And I tell you all this because I want you to know there are many other things out there that have always threatened our lives and our health and will continue to. And even if you aren't personally worried about COVID, it's incredibly important that you understand these other things are being given less attention, less focus because of COVID. And it's all the more reason for us to work together to get back to life again. And so I hope we can have a conversation about measures that we all can take to get us back to life and how this pandemic has impacted all of us. So thank you, Mayor Davis, for your leadership. Thank you for the conversation we're going to have today.
Well, thank you, General Adams. I'm incredibly, again, honored to have you with us here in the city of Augusta and sharing really your life story and the challenges that we're facing on a day-to-day basis. From a perspective of Augusta, we've obviously been hit with COVID-19, just like cities all across America have been. And just as information, what citizens understand and know, but I'll share with you on today, I received our most recent update with regards to the number of COVID cases. We're reporting here in the last 24 hours an additional 97 cases. Cumulatively, we've had over 14,000 cases here in Richmond County. Those are the confirmed PCR cases. And from an antigen standpoint, an additional 52 cases in the last 24 hours. So just like communities all across America, we're challenged from a hospital standpoint, the number of ICU beds and their availability, general care beds, of course, our ER beds. We're going through all of those same experiences as many other cities are, but yet we've done the 3 W's. We're wearing a mask, we're washing our hands, and we're watching our distances. And that's a message that we've been sharing really since March of last year, and we will continue to do that as we move forward. As we talk about this conversation on tonight, and it is an extremely important one, as we're sharing really the challenges associated with making sure that people step into that place of adopting the idea that we should get the vaccine, and then of course our rollout. And so while this is a much needed conversation in our communities, frontline workers have already begun receiving their first series of doses of the vaccinations. We also see here in Georgia and in this community as well, that those that are in long-term and extended care facilities are experiencing the vaccination, they're getting that. And so yet we find ourselves at a place where there are, according to the public health reporting from this morning, there are reported 46, almost 47,000 requests for vaccination. So clearly there's a demand, there's a desire for people to be vaccinated. Our EMA, Emergency Management Agency, continues to field public safety calls for the vaccination as well. And so as we move through our conversation on this afternoon, we want to ensure that Augusta and those that are in our surrounding region, Augusta from a healthcare perspective, really drives the economy and meets the needs of people in South Carolina as a border city. So much of the healthcare continuum is right here in the heart of Augusta. And so people need to understand what it means for the virus itself and offer insight into what to expect as we begin to navigate the next stages of COVID-19 over the next few months. So my first question that I want to pose to you for our viewers, can you explain how the COVID vaccines work? It's my understanding that the virus was not actually used in the creation of the vaccine, unlike the flu. So how does it differ from other vaccinations?
Well, great question to start with. And I just want to say right off the bat that the virus was not used to make the 2 COVID vaccines that are out there right now, the Moderna and Pfizer vaccines. You cannot get COVID from the vaccine. I wanted to dispel that myth right off the bat. But to know how a vaccine works, it's important to understand how our bodies fight disease. When germs such as the virus that causes COVID-19 invade our bodies, they attack and they multiply. And this is what we call an infection. Important to understand that when you have an infection, it can take several days or weeks for your body to respond to that. And one of the main ways the body responds is by producing what we call antibodies. After the infection, your immune system remembers what it's learned about how to protect the body against the disease. Those antibodies stay in your system, and if you face that virus again, then your body can mount a response to it and keep it from invading your cells, keeping that infection from spreading. COVID-19 vaccines help us by allowing our body to develop immunity without getting the illness. Normally trigger the body's natural immune system to fight the disease. So that's the magic of vaccines, is it allows us to get the benefits of that protection without having to actually get sick, possibly end up in the hospital and die. Now, there are many types of COVID vaccines in development, but the 2 types that are the kind right now that are the 2 vaccines that are currently out there, the Moderna and Pfizer vaccines, are what we call mRNA vaccines or messenger RNA vaccines. These vaccines contain material that gives our cells instructions for how to make a harmless protein that is unique to the virus. And it's kind of like sending your body an email. And your body reads that email with instructions for how to make that protein. And that protein looks like the virus. So you develop antibodies to that protein. And so when you are exposed to the virus in the future, those antibodies are there to attack it. Now that email gets deleted within 48 to 72 hours. So that vaccine is gone within 48 to 72 hours. And beyond that, it's just your own body's natural immune system working the way God intended it to work to help us fight off disease. So not using any part of the virus doesn't remain in your body, can't cause you to get COVID. And another important point that's a frequently asked question is, how did this happen so fast? Well, I want people to understand it actually didn't happen quickly. It's happened over a decade. We've been developing the platform to use for over a decade, and it's been used in other vaccines. And so the example I give to people is the one I use when I talk to my kids, because they're all excited about the Xbox, the PlayStation. You know, they wanted one for Christmas. Dad didn't get them one. I couldn't afford it on a public servant salary, but they're still on me for it. But what I want people to understand is that if you have an Xbox or a PlayStation and you want to change the game out, you don't throw the whole Xbox or PlayStation out. What you do is you change the part that allows you to play a different game. And so this platform has been around for over a decade. We know it's safe. It's been administered to tens of thousands of people, hundreds of thousands of people over the last decade. And we just simply changed out the part that allows it to recognize SARS-CoV-2, the virus which causes COVID-19. That is how we were able to move so quickly. It's called platform technology. It's safe, it's effective, and it is why I felt comfortable getting the vaccine. And hopefully many of you saw me get my first dose at the White House with the Vice President. And today on live TV, I got my own second dose of the COVID vaccine. And right now, not even any sore arm. I had sore arm after the first dose. After this dose, I feel fine so far, but normal to have a little bit of fever or headache in some people, because that's your body's immune system doing what it's supposed to do and developing those antibodies reacting to that vaccine.
That's fantastic. When you think about the term that's been used, warp speed, you've really leaned into that, Dr. Al. Can you speak to the number of people who were part of the trial? That's one of the questions people participated in, Pfizer or Moderna, and how does that help us from a trust standpoint, knowing that it went through thorough testing and that people are confident in terms of its efficacy? You hear about 95%, effective. Can you talk about that with so many people watching and listening in?
Well, important for people to know that the average vaccine trial enrolls somewhere between 5,000 and 10,000 people, usually closer to 5,000. Each of these trials enrolled 30 to 60,000 people in them. So the real truth of it is we will have more information on these vaccines at the point at which we first administer them to people than we've ever had for most any other vaccine in history. Right before I got on this Zoom call with you, I was on the phone with AstraZeneca, which is another company developing a vaccine. And Dr. Fauci and I are constantly in contact with these companies to make sure they have diverse enrollment, not just large enrollment, but diverse enrollment, because we want people to understand that individuals who look like them, who talk like them, who have the same genetics as them were involved in these trials. And so large trials that we've worked hard to make sure have African Americans, Hispanics, other minorities enrolled that are representative of the populations, which is, again, why I feel these vaccines are safe and why I feel that they are effective and why I was comfortable getting the vaccine myself.
That's fantastic. We have a question, Dr. Adams, that's coming from the public. Is the COVID shot effective for cancer patients, and is it safe for them to take?
So great question. And I'm going to broaden that lens a little bit because there's cancer patients. I've asked that question about immunocompromised patients in other ways. I've been asked that question about women who are thinking about becoming pregnant. What I want you to know is when we do a trial, we start off working with healthy people, and we want to make sure it's safe in them, and then we move to other populations. These trials have, in fact, included people in them who have cancer, who have diabetes, who have high blood pressure. They were first shown to be safe in healthy people, and then we expanded them to include people with comorbidities. Comorbidities is a word we use to say people who have other diseases. And that was important to us because we know that the people who are disproportionately dying from COVID are people who have these comorbidities. So it is safe to get this vaccine if you have cancer or if you're immunocompromised, because again, we aren't giving you the virus. We're just giving you a protein and letting your body's own immune system work. It's actually incredibly important if you have one of these comorbidities to be willing to get the vaccine, because you are at higher risk for hospitalization and death if you get COVID-19. For women, I do want to say, because this is a common question that I'm getting, that there were not pregnant women intentionally enrolled in these trials, but there were women who became pregnant during these trials and women who breastfed during these trials. And again, because we're not actually giving you virus, scientifically, we feel that it is safe to give to pregnant women based on what we know right now. And more women will be intentionally enrolled in these trials who are pregnant moving forward, because now we know it's safe in healthy people and non-pregnant people. And we're starting to do more studies in pregnant women. But I would say you should talk to your health provider if you're in any group and you have questions. Don't let misinformation or fear cause you to make a decision which could negatively impact your health. And remember that in many cases, these groups of people who I'm talking about, pregnant women, cancer patients, immunocompromised patients, are at higher risk of dying from COVID. So there's a good chance your healthcare provider is going to say to you that in your own individual situation, they feel the risk of the vaccine is much lower than your risk of getting COVID with this new surge going on. So I don't want to give anyone any individual health advice, but I do want to say in general, we feel like it is safe for these groups. And specifically, you should talk to your health provider if you have further questions.
How long, Dr. Adams, will the vaccine last? So you talked about you received your second dose on today, which was 21 or 23 days after the first vaccination. And so how long will that last? You know, for every year, we're told to go back and take the flu vaccine. From a COVID standpoint, will we have to be revaccinated each year like the flu shot?
So one of the most important things about this whole virus in this past year is that we need to understand a year ago, we didn't even have a name for this. We didn't have the virus sequenced, and we are learning each and every day. And I want to be honest with you about that to preface the fact that I'm going to tell you, we don't know how long immunity is going to last yet, because no one has had the vaccine long enough for us to be able to say at X point, you're no longer protected. What I want people to know is this is something that we are watching. The trials don't just end when we approve a vaccine. We continue to follow these patients out for years to make sure they're still getting protection and that there is no harm that is occurring to them. I do want you to know that when we look at vaccines, universally, people who have complications from vaccines usually have them very, very early, like in the first days to the first weeks, which is why we feel confident in the safety of these vaccines. But different vaccines, the immunity wanes at different points. Some people need boosters like tetanus. That's something people may be familiar with, where you have to get a booster every 10 years. With flu, what happens there is that the virus mutates. It's a different strain that causes us to have to get a new flu vaccine every year. Now, here's the good news. The good news is that there have been people enrolled in studies since June, July, and we still see that they have protection. So we expect now that it is at least 6 months of protection that you will get. Moderna had an announcement in the last week where they feel that their vaccine will give protection for up to a year. And so far, we aren't seeing this thing mutate as much as flu does. So we are hopeful that this will provide long-term protection. But what I want to say to people is, even if it doesn't, we're going to follow it, we're going to study it. And if we have to get a vaccine every year to keep this virus under control, then that's no different than what we do for flu, and we'll do that. but it's important for everyone to get their vaccine now so that we can get this pandemic controlled and get back to life.
I couldn't agree with you more. I want to urge all of our Augustans and those that are in surrounding counties as well who may be tuning in that it's so incredibly important. Please sign up through the Department of Public Health. You can go to the dph.ga.gov website and find our local East Central Health Regional offices and sign up for the vaccine. That is extremely important. My parents, they were vaccinated on yesterday. They took their first vaccine on yesterday. They feel really good. I sat with them earlier and they are excited about what lies ahead for them, knowing that they're going to be stronger and healthier. So I just want to encourage all of our citizens to really take an opportunity to sign up, make sure that they have a chance to get the vaccination. There was a question that came in earlier about an individual being in group 1C, those that are under 65 but with health conditions, having an estimate about when they get a vaccine. The governor most recently had a press conference and they are working on guidance for phase 1C. Currently, we are in phase 1B. We went with healthcare workers, first responders. We're still working through that. Those that are in long-term care facilities are also being vaccinated right now. And those that are 65 and older are being vaccinated right now. So again, please stay tuned. Go to that website, dph.ga.gov, and you can get up-to-date information in terms of what the vaccination rollout and process will be. Dr. Adams, we have another question. For those under 16, what's the research thus far in terms of COVID-19 infecting them, but more importantly, being vaccinated? Can you speak to that?
Again, great question. For any medication, any vaccine, we typically test it in healthy adults first, and then we go to other groups whose biology may be different. So important to understand, it's perfectly normal to not have data on people under 16 at this point as far as the efficacy of a vaccine, but children are being enrolled in the trials now to make sure it's safe. And we should have an answer about safety in children by June, which the great part about that is that's about when we'll have all the adults vaccinated. The other nice part about that, quite frankly, is that we know that while kids aren't at zero risk, they are at lower risk than older adults. So we want to make sure we're getting these older adults vaccinated and then working our way down to people who have medical conditions who are adults. And hopefully, once we get through them, we'll have information to be able to safely say that kids can be vaccinated. We expect that they will be able to be safely vaccinated. Here's the real danger with kids, because I don't want people to hear that kids are at no risk. Children still can get this virus. I've heard some horrible stories about children when they get it being long haulers. And so you don't want to take any chances with this virus. Lower risk doesn't mean no risk. And here's the other key, and this is important, particularly in communities of color. We like to get together with our families. And while the grandson or granddaughter may not be at high risk for complications, they are in fact at high risk for getting and spreading the virus to grandmother or grandfather. And so what we need to remind people of is that this virus actually, it's a nasty little virus. It preys on our desire to come together. And so it's important right now that everyone who can get vaccinated, as the mayor mentioned, gets vaccinated to protect yourselves. 95% effectiveness. I don't think people understand how tremendous that is. The flu vaccine in any given year is about 50% effective. And we still tell people to get vaccinated because 50% is better than 0% protection. But 95% protection, this vaccine is twice as effective as the flu vaccine at preventing you from ending up in the hospital or dying. And so we need people who can get it to get it, but we need everyone to still continue the 3 W's: wear a mask, wash your hands, and watch your distance. And under watch your distance is another W: wait to gather until we can get this virus a little bit more under control so that we can get to Easter, get to Memorial Day, get to July 4th, and be able to have some of those gatherings again in a much safer setting.
Great. I want to re-echo those sentiments that, again, I like the fourth W, and that is wait to get together. We had, a Zoom Christmas with our family and friends, the same thing for Thanksgiving. My parents both are over 70, and so it's extremely important. We want them to be around for a long time. So I'll add that fourth W, and that is wait to get together. Use technology to the best of your ability, whether you're using FaceTime, Zoom, Ring Central, all of those things I think are incredibly important as we are trying to fight this pandemic, and it requires all of us to be a part of that process. You mentioned something, Dr. Adams, that I think is extremely important, and that is COVID-19 is a very nasty virus. We've heard more recently that there's a variant. We had our first case here in Georgia, an 18-year-old non-traveler who has contracted the more transmissible variant of this virus. Can you speak to that, particularly in light of the fact that we don't want people congregating, getting together in large groups of people, because one, we don't know if that variant is in your group or not. But what we do know is we want to keep people safe, wearing a mask, washing their hands, watching their distances, waiting to get together. Can you speak to that variant, which we understand now is highly transmissible, which is why it's so important for us to continue to be vigilant in our fight?
That's a common question that we're getting nowadays. Important to understand that viruses mutate. That's what they do. Even before September of this year, the virus which causes COVID had mutated over 20 times. That's what they do. They're always evolving. They're always trying to adapt to get better at infecting us, to get better at spreading, because that's how they live, going from host to host to host. Now, that said, the new variants that we're hearing about do appear to be more transmissible, more contagious, if you will, than the original strain. But when we look at the data, it doesn't appear that they are any less affected by the vaccine or by therapeutics. So that's incredibly important, because that means that we still have a window here. And in this window, it is critical that we get this virus under control, that we get vaccinated while the vaccine still works against it. And again, if it ends up that we need to change the vaccine, we'll do that. But that takes time. And in that time, more people get sick and more people can die. So incredibly important that we get the vaccine now, that we suppress this virus, that we take the measures now to limit spread, the 4 Ws, because if a more transmissible virus is out there, that just further underscores the need for us to take these safety measures. So I want you all to understand we have the tools, but we need to have a 5th W. I like these W's here, Mayor. We need to have the will to do it. We got to make sure we have the will to go out there and get this under control. And now with vaccines rolling off the out of the factories, I want you to know that the finish line is in sight. We really can have every adult who wants to get a vaccine vaccinated by June of this year in America, every adult in America. We could actually move that timeline up to closer to Easter if the AstraZeneca and Johnson & Johnson vaccines continue as they look like they might. So not that much longer that we've got to hold on, but we got to be really vigilant. And when I say this virus is nasty, people say, well, you're telling us to do all these things. They don't appear to be working. I want you to know that more people than ever actually are wearing masks and are avoiding public gatherings. Here's the challenge. People now are gathering amongst families, amongst neighbors, amongst friends. And so it's not that they stopped gathering, they just stopped gathering in the public square, which is a good thing. But you have to understand 50% of the people who are spreading this virus are doing it asymptomatically. And asymptomatic means without symptoms. So if the mayor and I, one of us, if I had a cold, the mayor would likely know it. The mayor would look at me and say, Dr. Adams, you're sneezing, you're coughing, you have watery eyes, you look bad. Are you taking care of yourself, Dr. Adams? That's what the mayor would say to me. I could have COVID right now, and the mayor wouldn't know it, wouldn't necessarily know it by looking at me, because half of the people who have it don't know that they have it. And that's why we've got to take these measures now to stay safe. Why we have to wait to gather, especially with this new, more transmissible variant out there, until we can get more people vaccinated.
Well, I'm going to add that last W to the conversation, and that is the willpower to be vigilant. You know, we hear so much about COVID fatigue. I hear it in the community as well, where, you know, we've been on this long haul since March of last year. And now that we do have vaccines available, one of the questions that is tonight is the issue of if those in long-term care facilities and nursing homes are being vaccinated, can we now go and visit our loved ones and be a part of that and have those in-person meetings? Can you speak to that? I tell you, I am cautious about that because, again, as you well said, I could be asymptomatic and not have any symptoms, but yet carry the virus, and then the next thing spread it. So, talk about that, particularly with regards to if those in long-term care facilities and/or nursing homes are being vaccinated, is it now the green light for our family members to go and see them?
Well, important to understand what you talk about lights. I'm going to use another light analogy. In your homes, you have light switches which go on and off, but in many of our homes, you have dimmer switches that you kind of dial up and dial down. This is not going to be a light switch where we flip a switch one day and all of a sudden say we're back to normal. It's more like a dimmer switch where we slowly are turning the lights back on so that they get brighter and brighter and brighter. But I want you to know 2 vaccines available and possibly another 2 within a month authorized, that light is a little bit brighter. I want people to remember 40% of the deaths in this country have occurred in 0.4% of the population. 40% of people who've died represent 0.4% of the population, and that's people in our nursing homes and long-term care facilities. So the reason we want them to get vaccinated, first of all, is so they can be alive in March, in May, in June for us to go and see them. And that is important in and of itself. That's turning that light switch up, that dimmer switch up just a little bit. Now, when it comes to protective mechanisms, no one's ever going to be able to give you a 100% thumbs up to go to go and do these things. What we do is we layer protection on top of protection on top of protection. And once nursing homes feel like they've gotten their staff and their patients vaccinated, they're going to feel a little bit more comfortable saying, okay, well, now we can have people start to come in from the outside if they're asymptomatic, if they're wearing a mask, if they're staying 6 feet from one another. And that's going to be turning that dimmer switch up a little bit more. A very responsible interactions with people in nursing homes who are vaccinated. But remember, 95% effective isn't 100% effective. So we still don't want to just go willy-nilly and put people at risk. And there are still going to be people in nursing homes who choose not to get vaccinated. So we have to be careful. But I do think that we will start to be able to increase visitations. It won't be back, it won't be like it was pre-COVID right away, but we'll slowly start to be able to strategically, intelligently increase visitations. But that, again, relies on people getting vaccinated. I think you'll also hear some nursing homes across the country, and you see flights already doing this. Some institutions are going to say, look, we are going to be more likely to let you come in if you got vaccinated.
Right.
It's not just about your grandma getting vaccinated. They may say, look, if you've been vaccinated and she's been vaccinated, then we feel safer about you coming in. But if one of you hasn't been vaccinated, and certainly if both of you haven't been vaccinated, then we don't feel as comfortable with you coming into the nursing home and potentially putting other people at risk.
Yeah, absolutely. I just saw some recent CDC guidance this afternoon about international travelers coming into the U.S. and the requirement to have been vaccinated to be COVID-free. So I think that's going to be a part of our current norm and certainly extend well into the summer. When I look at what's taking place right now, I want to remind all of our Augustans and those that come into our community that there is a mask mandate in place right now. It is a requirement to have a mask. It's important also for everyone to understand that that executive order has been in place and remains in place around citizens wearing a mask, washing their hands, and watching their distance, whether that be in commercial retail establishments, restaurants, and when you certainly come into government buildings and public spaces, that requirement has been in place and continues to be in place as we make our way through this process, even with the understanding that vaccinations are being done in Augusta. As we lean in some more, Dr. Adams, one of the global concerns that people have in the community, and certainly particularly around Black and Brown communities, those that have been hit the hardest When you look at the number of COVID confirmed cases, the number of deaths, we've seen our fair share in the community as well here in Augusta. But let's lean in a bit, especially around Black and Brown communities. Many people are fearful about getting the vaccine. What advice do we provide to people to ensure them that the vaccine is safe? We want to make sure that we get it to every part of our community as those adults make themselves available. Early adoption is extremely important. I talked about this on this past Sunday at length of how vitally important it is. So often, those in the faith community, we pray for an answer and we ask God to give us understanding, to give us wisdom. I know in our church, we prayed for an answer. And so now that we have two vaccinations, two potentially coming quickly with emergency federal authorization, now that it's here, particularly those of us that are in the faith community, this is what we've been praying for. Now, how do we help further alleviate those fears with the vaccines, especially around Black, Hispanic Americans, the groups that have been hardest hit by the coronavirus pandemic?
Well, I won't get into my fables or my proverbs here, but I will remind people about that story of the guy who was in the boat
Right.
that was going down, and he kept turning down the help, and then finally he ended up at the pearly gates, and he asked, "Why didn't you help me?" And God said, "I kept sending you help, and you kept turning it away." And
Right.
at the end of the day, you're right. We have been praying for the last year for a end to this pandemic, and I truly believe these vaccines are a gift from God. I'm a man of faith, and I believe that everything that I do through the direction, through the knowledge, through the coordination of a higher power, and that includes the scientists who've been working on these vaccines. So when we say we won't get a vaccine or we're going to wait to get a vaccine, that is us being that man in the boat that says, no, I'm going to wait for God to save me, and then find out later that God was trying to save you all along. But that said, I also want to be plain with you, and I want people to understand that we have to acknowledge the real history of mistreatment of the Black and Brown communities in our nation by the government and by the medical establishment. The Tuskegee studies, which people hear about, and a lot of people say Tuskegee, and they don't really understand Tuskegee. They just say Tuskegee. It's just it's a word now that just scares people. But the Tuskegee studies started back in 1932, and they were studying men who had syphilis, and they asked Black sharecroppers to enroll in these studies, and they actually denied them treatment for over 40 years for syphilis because they wanted to see how it played out in these communities. So the irony is that the Tuskegee study was about denying treatment to Black people, and the legacy of it is that now Black people deny treatment to themselves because they distrust the government. So, the way that we reverse the impact of the Tuskegee study, the real true base impact, is by making sure we get informed and we can make intelligent decisions about our own health, and that we avail ourselves of these miracles that have been sent down to us in the form of modern medicine. But I say we have to acknowledge because there's too much shaming going on. And as a physician, I don't shame people. I would never tell someone they're wrong for asking a question. We can't even tell people they're wrong for distrusting the government from a base point of view. But I then say, okay, but what have you done and what can we do together to help you understand the protections that are in place, that have been put in place since then, to make sure Tuskegee can never happen again. And we have an Office of Human Research Protections, which full-time job is to make sure people who participate in studies aren't preyed upon again. That was started up after Tuskegee. We have a African-American female who helped develop the current vaccines that are out there. We have a independent data and safety monitoring board, which was involved in each of these studies. Independent people who looked to make sure the vaccine was safe, it was efficacious, and the study participants were treated right. The FDA has a VRB PAC, a vaccine regulatory board committee, which was comprised of about a third people of color. The CDC's Advisory Committee on Immunization Practices is another independent committee. About 20 people, 4 of them identify as people of color, who are looking independently at the safety and efficacy of the vaccines and the regulations. And I say all these things because I want people to know that it's appropriate to have questions. I understand where the mistrust comes from, but I also want you to understand that we've addressed a lot of these concerns over the past several decades since Tuskegee to make sure it can never, ever happen again. I want you to make an informed decision about your health, not a decision based on something that happened 80 years ago, but a decision based on the reality on the ground right now. And if you choose not to get a vaccine, I'm not going to shame you, but I am, as a physician, going to continue to try to help you understand why I chose to get the vaccine. I'm going to continue to help you understand, as a physician, that the benefits far outweigh the risks. I'm going to continue to help you understand that disparities in this country and in your community are only going to worsen if we continue to turn away the miracles of modern medicine that God has sent to us.
That's fantastic. I'm reminded that we are, in fact, our brother's keeper. And so when you think about your loved ones, as you said it earlier, I may be a younger person, but I've got an elderly parent. I've got an elderly grandparent. And so I've got to do those right things as a brother's keeper, a sister's keeper, quite frankly, a keeper of my loved ones, where I have the opportunity to be vaccinated, informed opportunity to be vaccinated. So I want to, again, encourage all of our Augustans to avail yourself of information that we tonight, take an opportunity to be thoughtful about it. Go ahead and go to the DPH's website, sign up for a vaccination appointment so that we can make sure that not only are you vaccinated, but you're helping to stop the spread of the virus, keeping our family members, our loved ones, and even our co-workers safe as we navigate through this.
You can go to dph.gov, as the mayor said. You can go to vaccines.gov, or you can go to cdc.gov and get that information so you can make an informed decision. Remember, 95% effective. We have a tool out there which will decrease your chance of ending up in the hospital, the ICU, or dying by 95%. Please, please don't just turn it away because of misinformation. Get the facts, and hopefully, like me, you'll get the vax.
I like that. I look forward to getting vaccination. Again, my parents have done it. I look forward to doing it as well. To those of you who are looking for an opportunity to sign up, you can call the DPH hotline for the vaccine and register. That number is 1-888-357-0169. Again, that number is 1-888-357-0169. We want you to avail yourself of this opportunity. We want to make sure that Augusta's strong and we're taking care of all of our citizens. You know, travel is something that's been curtailed across this country. I certainly see that as I speak on a regular basis with my airport director, Dr. Adams. What can you tell us as you travel the United States? What have you heard from constituents that we should be aware of in Augusta that maybe we've not heard about? What should we be hearing?
Well, I want people to know that, again, this virus feeds on us being around people who are outside of our immediate household. So anytime you're traveling or you're around people outside your immediate household, you're putting yourself and them at a higher risk. Sometimes we just can't avoid it. Sometimes we have to travel for work. I have to travel for work. Sometimes you've got to travel to be somewhere. And there are things that you can do to travel more safely. Please make sure, if you're going outside your household, and especially if you're traveling, that you have a mask. I usually bring a couple of masks just in case you lose one. Make sure you're wearing it at all times. Make sure you're practicing good hand hygiene, because what we don't want you to do is touch something and then touch your mask and your whole mask is contaminated. So practice good hand hygiene, and know that airplanes themselves have been shown to be relatively safe when you're on the airplane if you're wearing your mask and you're not touching anything. What I worry most about are the airports. When you're out there going back and forth next to people, I got to tell you, I was at the Atlanta airport about a month ago, and the bar at the airport was packed. And that was something that didn't sit well with me. And I never like to call people out, but we're talking about Georgia. I want you to know that if you do travel, what you don't want to do is put yourself intentionally in an environment where you are surrounded by people who you don't know, because 6 feet of distance or less is that danger zone, and particularly when you're not wearing a mask. And when you're out and about, I think that's when most of the spread is occurring, is when people are out and about at restaurants, at bars, too close to other people without a mask on.
Absolutely.
But also get your vaccination and you can travel soon. If we can get, I really do mean this. I want people to understand that the quicker we all get vaccinated, the sooner we can get back to life. So we got to hold on a little bit longer. We need to get informed. We need to get vaccinated to break transmission. We need to encourage people around us to get informed and get vaccinated to break transmission so that we can get back to life.
That's great. That dovetails right into our next segment around the deployment of the vaccine. As we switch gears, Dr. Adams, here's what we know about the deployment of the vaccine as of January the 6th. According to the CDC, over 21.4 million doses have been distributed, but only about 5.9 million people have received the first dose. To put that in perspective, according to a recent Healthline report, Israel, a smaller country than ours, has vaccinated 19%, over 19% of its population, about 10 times the rate of the United States of America. What can we do in the United States, and certainly here in Augusta and in Georgia in particular, to change our vaccination rate? What can we do?
Well, this is something that's been incredibly important to me. And I want people to understand a couple of things. First of all, I want people to understand that the rate of increase is rapidly increasing. So the numbers as of this morning were 9 million people vaccinated, which is more than any other Western country. And we are vaccinating about 700,000 people a day now. So that's gone up significantly. We expect to be vaccinating 1 million people a day within the next week or two. So we're rapidly ramping up. We always knew this was going to be difficult. It's still going to be it already is, and it's going to continue to be the most difficult and the largest mass vaccination project in history. So we knew it was going to be difficult. We intentionally started with nursing homes and healthcare workers. And I want you to understand, neither one of those venues is a mass vaccination venue. You can't bring massive numbers of people into a hospital, and you also can't bring massive numbers of people into a nursing home. So that is part of the slow rollout. We also knew that states were, quite frankly, a little reticent to move from 1A to 1B to 1C as quickly as we probably should have. But now we've adopted a strategy, and we announced this today. So this morning, I announced on the news that we are putting out CDC guidance to tell all states, look, open it up to everyone over 65, quickly move to people who are 64 and under with comorbid conditions. And I want people to think about it like loading a plane. You load first class, then group 1, then group 2, then group 3 on a plane. But guess what? If the person in first class wasn't there when they called your boarding zone, they don't hold up the entire plane and wait for you to board. They also don't stop you from boarding the plane when later on. And that's where we are right now. We need to move through these other phases more quickly. We're going to support mass vaccination sites by states. We're opening it up to CVS, Walgreens, and 19 other pharmacy chains to put vaccines closer to people. We're going to put vaccinations sites in our community health centers, which disproportionately serve people of color. And we are have already sent out a lot of this, $3 billion with a B dollars to states to further ramp up their vaccination protocols. So certainly not gone as quickly as we would have liked. But if we're going to be honest about it, from a public health perspective, we knew it was going to be challenging to ramp up, particularly with the groups that we prioritized first. And what's most important now is that we see things ramping up. What scares me is that even within those higher priority groups, we still see people of color preferentially choosing not to get vaccinated. So even within the healthcare groups, group 1A, even within the nursing home patients, group 1A, we're seeing people of color saying, nah, I'm going to wait. And that has the potential to worsen disparities and continue to let this virus wreak havoc on communities of color. So supply is ramping up, categories are opening up, but we still need to continue to promote vaccine confidence.
Absolutely. Again, I think it's important for us in this community and certainly our neighboring counties as well to get this message out that we want everyone to get vaccinated. Everyone who's eligible for vaccination and is of age, we want to make sure that you go sign up and get vaccinated. Here in the state of Georgia, I urge my fellow colleagues over in South Carolina, just right across the river from us, to do the same because we are neighbors, and the transitory nature of our communities and our workforces require us to do that as well. I pivot now, Dr. Adams. We've heard President-elect Biden talk about releasing all available vaccine doses. Some medical and as well public health professionals are concerned about the possibility of that. Can you give us some insight into their concern? Is that appropriate for us to do that in an effort to try to get as many people vaccinated in that first dose as quickly as possible, with an understanding that as manufacturing ramps up, that second dose will then in fact be available? Give us your thoughts about that.
So you hit the key points there. But first of all, I want people to understand these studies were done on the Moderna and the Pfizer vaccines based on 2 doses. That 95% efficacy is based on getting your second dose. And so we need to follow the science. We need to make sure everyone has the opportunity to and is encouraged to get that second dose in that time window that the studies show you should get that second dose. So that is our priority from a scientific point of view. Logistically, you have to ask yourself, how does that happen? And when you start producing a vaccine for the first time ever, we simply did not feel that we could guarantee that second dose to people unless we held back a certain reserve. The plan was always, once we saw that production was going well, to start releasing all doses. But we first had to go a couple of weeks and make sure, hey, Pfizer, Moderna really can produce 8 to 10 million vaccines a week. And we really can feel confident that in 3 weeks, if you get your first dose today, that you'll be able to get a second dose if we don't have one held back for you. And so we are now at the point where we've had 3-4 weeks of seeing these vaccines being produced. We feel confident now that we can start to release all vaccines produced because we feel confident they will be able to keep up. And we also have a certain amount in reserve. So now is the appropriate time. And it was always about the time window when we anticipated releasing it. And so I want people to know that is occurring and it will start to occur. And we do feel it's appropriate, but we also will continue to look at the vaccine supply because one of the challenges is these vaccines are made with supplies from all around the world. So at any time, you could have a shortage of ingredient A or ingredient M, and that could cut short your supply. And so we may have to choke up again on the release, but that's something we're continually following with the knowledge that the way the vaccine was authorized was as a 2-dose vaccine, and that we have to feel confident that we can give everyone 2 doses so that we can follow the science. And right now we do feel confident in releasing that second dose and not holding on to additional vaccines. Fantastic.
Dr. Adams, the year 2020 was a year that we had to learn how to be resilient, not only how to be resilient in ways that we never thought of, but as we look at the lessons of COVID-19 and what we, whether it's from an economic standpoint or tourism or travel, hospitality industry, we've had to learn so much. From your perspective, as we start down, what are some chief learnings that you are able to share with us that we can take forward as we might experience other health pandemics, health emergencies? What are some key learnings that we can take away from this in our community here in Augusta?
Well, thank you for that question, because that is incredibly important to me, that people don't focus so much on putting out the COVID fire, that they don't recognize all the kindling that is sitting around our communities all the time and all the other fires that have been burning in the background the entire time. So I want to give you a couple of real concrete examples. I put out a call to action on October 7th of last year on hypertension control, high blood pressure control. And some people thought I was crazy. They said, we're in the midst of a pandemic. Why are you focused on high blood pressure? Well, the reality is more people died in the United States last year from uncontrolled blood pressure than died from COVID. And more people will die this year in the United States from uncontrolled blood pressure than from COVID because the numbers are so astronomical. And so we can't afford to lose focus on these risk factors that are killing people long before COVID and will continue to kill people long after COVID. But here's the benefit of taking a more holistic approach. Having uncontrolled blood pressure doesn't just put you at risk of dying from stroke and heart disease, it also puts you at higher risk of dying from COVID because those other things are comorbidities and they put you at higher risk. So when we control high blood pressure, we control an array of things. We also know that people who have uncontrolled blood pressure are more likely to miss work. So we talk about now the importance of people being able to get back to business, to earn an income, to pay their rent. Well, the more we can focus on these broader conditions, the better position people will be in, not just to be healthier, but to be more prosperous. And one of the other lessons that we learn is that it's not just about pre-existing medical conditions, it's also about pre-existing social conditions. So transportation, a safe, affordable housing, childcare, a job that pays a living wage. All these things are what we call the vital conditions for health. And when these vital conditions aren't met, then people have higher rates of cancer, higher rates of heart disease, higher rates of COVID-19. And that's what you saw play out in this pandemic. So my hope is that we learn the lesson that we have to meet these vital conditions for more people in communities. Another term that people use are the social determinants of health that you may have heard about. We have to address those so that we can create better opportunities for people to be healthier. And then those will in turn cause those pre-existing medical conditions to improve. And that will make us more resilient in the face of future threats like COVID, because this isn't the last, it's just the latest. And we will continue to face assaults on our health again, which will then in turn cause assaults on our prosperity and on our communities. Look at the opioid epidemic.
Right.
The epidemic we were talking about before, we were talking about COVID. You had factories that couldn't staff themselves because they couldn't find enough people who could pass the drug test. This is something that has plagued us for a long time. And I hope the lesson we learn from this is that healthy communities create a healthy bottom line. And I want to finish just by talking quickly about a conversation I had with one of your buddies, Mayor Benjamin from Columbia, South Carolina. He was the head African, and for those of you viewers who don't know him, another African-American gentleman who's the head of a major city makes me so proud. Makes me so proud as just the second African-American male to be Surgeon General of the United States. The other one was a Georgian, Dr. David Satcher, who you all may know. But I was having a conversation with Mayor Benjamin, and Mayor Benjamin, we were talking about walkable cities, and Columbia had a big effort to make their city more walkable. And I asked, Mayor Benjamin, why did you make your city more walkable? Was it to lower people's blood pressure? Was it to lower people's blood sugar? And Mayor Benjamin said, I created a walkable city to do those things because I'm passionate about those things. But I did that also because a walkable city is safer. A walkable city has higher property values. A walkable city is a place that young people want to move to. And we really need to help everyone understand that healthier communities are also communities that people want to move to. They're more prosperous, and we all benefit when we lift up health and give people opportunities for health.
You know, it's funny you mentioned that. Mayor Benjamin and I were close friends. We launched last year in 2020, Move with the Mayor, of which you participated with as well. And so that's extremely important for us. We want a healthy Augusta. We talk so much about One Augusta. So we're creating that environment for our citizens to understand that if you move with the mayor, We're creating healthier societies, both young and old alike, and really moving into that place of not only talking about smart cities, but a walkable city, but a city that has healthy residents so that they are here for a long time. Dr. Adams, our time has almost winded down. I'm extremely pleased once again to have your company on tonight and for us to have this conversation. I've heard from a number of citizens who are more encouraged, who now find reason and occasion to go out and take the vaccine. I think I heard you say this on tonight, that when you are informed and have the facts, go and get the vax. So wear a mask, wash your hands, watch your distance, and wait to gather and congregate. Those things are extremely important. And if we do those four things, it will keep us from worrying about whether your loved one is going to go into the hospital and we're going to need additional care. So I want to thank you tonight for taking time to speak with us in the city of Augusta, Georgia, Georgia's second largest city, the home of James Brown, the godfather of soul. And I really feel good about what we've talked about tonight. I hope our citizens do. And without question, home of the Masters Golf Tournament. Stay tuned. April 2021 is right around the corner. And we want to be able to welcome the world to our city. The only way we're going to be able to do that is if we attack this virus vigilantly, we get people vaccinated, and we continue to do these things, moving beyond the place of fatigue. This is where we hunker down and really continue to fight so that we can get to a place of normalcy, not where we once were, but normalcy, knowing that COVID is here for some time. And so with that, the reality of the vaccine is in front of us. We're really encouraged with what you shared with us. And so with that, I'll give you an opportunity to say just a final word as we close out on tonight, sir.
Well, I just want to close by saying that this has been a marathon. It truly has been. And I have run for quite a while. I'm a runner. I've run several half marathons. And the hardest part of a marathon or a half marathon are those last couple of miles. They're when you see people just dropping like flies. They're when everyone wants to quit. But when you visualize, when you can literally see that finish line in sight, no one quits running then, because they know I just got a little bit more to go to get across that finish line. And I want you to have hope, even in the midst of a terrible surge that we're in right now, because we have a finish line in sight, a finite finish line. We have 2 vaccines, and soon I think to be 4 vaccines available. We're producing at large enough amounts that we feel confident that by June, and probably much sooner than that, we can have every adult who wants to get vaccinated. So just understand that with that finish line in sight, we can't afford to stop running. We've got to keep running to the finish line, and we got to grab people and carry them across the finish line with us. So have hope, continue to do your part. And I'm sitting here in my office in DC. I'm looking out right now at the Capitol building. The final thing I want to say to people that has to do with the pandemic, as much as it has to do with what happened last Wednesday, is remember that we need to focus on and celebrate what unites us and rise above what separates us, because we either all rise together or we all ultimately fall together. And nothing has shown that quite like the COVID pandemic. So let's all pull together and make it to that finish line. And hopefully this year, but if not this year, then next year, you and I can watch the Masters tournament and celebrate all that Augusta has to offer. And you can show me around to some of the sites, because James Brown is one of my favorite singers in the world. And I just can't wait for us to get back to get to life again, and to what that new normal is going to look like, because I think there's a real potential for that new normal to be a better normal, a healthier normal, a normal that lifts up all people more equitably. And I just want to thank you for the opportunity to serve as the 20th United States Surgeon General, your Surgeon General, and the opportunity to address the people of Augusta and surrounding communities tonight.
Fantastic. Thank you, Dr. Adams. To my fellow Augustans and those in the surrounding communities, I want to just encourage you that this is an opportunity to have that eternal flame of hope in front of us, that we are getting better, we're getting stronger, And together we can do this. Keep your family safe, keep your loved ones safe, keep your neighbors safe, doing the 4 Ws. Wear a mask, wash your hands, watch your distance, and wait to gather until you've had that vaccine. Thank you so much, and God bless on you tonight.
Thanks. Good night, Augusta.